President Biden's health is putting prostate cancer in the national spotlight.
So joining us live right now is Dr. Ian Cooke. He's a Kaiser Permanente urologist. Thanks for joining us. If men are concerned about prostate cancer, what should they be asking their doctors?
Sure. So men should talk to their doctors, and in general, primary care doctors do most of the screening for prostate cancer in this country. So we advise talking to their doctors about how to get screened, what blood tests are needed, and kind of what ages does that make sense to do screening for.
I mean, I kind of worry because this was our former president and he had some of the best doctors, and and if there were urinary symptoms, how did it get to the point that it's already in his bones? It worries me, especially for just, the average person, the average Joe.
May not have access to that type of care.
Exactly. So what sort of screening is available and how can we prevent it from getting to this stage?
Yeah. So it's really hard to comment on, President Biden's particular case without knowing exactly his particular history. In general, for the vast majority of cases, prostate cancer tends to present without any major symptoms. Most prostate cancer that is diagnosed in this country is localized prostate cancer, and typically localized prostate cancer doesn't a lot of times have many symptoms. Of course, sometimes there can be symptoms of things like changes in urination, blood in the urine, blood in the semen. However, the vast majority of the time, something like a change in urination or new urinary symptoms are related to something like benign prostatic enlargement and not cancer. So usually prostate cancer doesn't have any associated symptoms with it for the vast majority of cases. And so as far as the mainstays of screening, one of the major things that we do is a blood test called a PSA, which stands for prostate specific antigen. The American Urologic Association recommends doing that every 2 to 4 years. So we generally recommend it around every 1 to 2 years. Every 1 year would be pretty frequently, but every few years or so. And that frequency can be discussed, on an individual basis with your doctor.
Who are highest risk groups? And you were saying, the warning signs very limited, but who are the highest risk groups out there? Yeah.
So we generally recommend screening start around the age of 50 for most men. So some of it has to do with age. Certainly, men in kind of above the age of 50 are at increased risk. Also, men who have a strong family history, men of African American ancestry, are also at increased risk. There are some genetic mutations that also have been linked with the development of prostate cancers. They're a little more rare, but still worth talking to your doctor about as well.
And I think that's key, what we've learned from this. You got to talk to your doctor about it. All right, Dr. Ian Cooke, thanks so much for joining us.
And any changes in your urination.